Okay, so let's get started. So what you're seeing right now to the left of the screen there is the entirety of the system. You've got the heart, you've got the container, and you can't really tell as far as seeing the movement right now, but the fluid is inside of this container. All of these things are functioning together along with the lungs to provide our perfusion. Any type of issue with any part of this can lead to hypoperfusion, or what we're going to call shock in this class. One of the things we need to always think about is that the heart itself requires itself to beat a certain amount of times a minute, pushing a certain amount of volume of fluid through it every time that it beats. The more in shape that heart muscle is, the less times a minute it needs to move the blood around that's needed by the rest of the body. And so one of the questions we had in class the other night was, why do runners and those that are in such good shape have a lower heart rate? And it's just because the pump itself just works much more efficiently. Whenever you're moving a fluid, the more efficient the pump is, the more fluid that's moved with every single contraction or every single revolution of another type of a pump, the more fluid moves through it. When the heart itself is not in good shape and the contractility is lower and the amount of force is lower, it's not going to move as much blood forward, and that would require more beats per minute to actually do the same job. And so when we look at things like the heart, and we look at things like the vasculature, and we look at things like the fluid that's inside of it, we need to kind of break it down a little bit further. But let's start by just taking a brief kind of look at the overall system here. Now, obviously, there's a lot more blood vessels than you see now. We have a lot of capillary networks, a lot of arteries and veins that go everywhere that any type of cells exist. It doesn't matter if it's your foot, it doesn't matter if it's your head, it doesn't matter if it's your kidneys. All of the cells require some type of circulation to get to them. But what this highlights here is just kind of the main network of the arteries and the vessels, the veins, and you can tell by the colors which one is which in terms of the depiction here. And we already mentioned that in class that whenever you see in a book or in a video blue, you're going to think the veins. Whenever you see red, you're going to think the arteries. Pull up another diagram here, and we'll get into the heart itself. Okay, so in front of us here, we've got the heart all by itself, separated from everything else so that we can take a good look at just that. This over a little bit. There we go. Now, first things first, when you talk about how the heart sits in the chest cavity, this generally is going to be the position. Now, like the lungs, we're going to refer to the heart with an apex and a base. But unlike the lungs, where the apexes were at the top and the base at the bottom, the heart's apex is here at the bottom of it, and the heart's base is up top. It's designed that way because if you think about how the heart beats itself, it actually beats from the base to the apex, with the atria firing first and then the ventricles firing. And so that's how it's labeled. Now, the heart is also surrounded by a sac. We talked about that sac that surrounds the lungs called the pleura. The heart has a sac also. It's called the pericardium. Now, that sac is designed to protect the heart. That sac also has a little bit of fluid inside of it that sits between the outside of the sac and the inner wall of the sac, which is up against the heart muscle itself. Those are also known as the parietal and the visceral parts of the pericardium. Just like the lungs has a parietal and a visceral part. Anytime you talk about a sac surrounding some organs, they're going to have both parts of that. The visceral part of the sac is always the part that is up against the organ. The parietal is the outer part. If you do get fluid accumulating in this sac, like blood from an injury or from infection or anything like that, too much of that fluid can cause the heart to not beat as efficiently or actually beat much blood through it at all if it gets too bad, and that can be deadly. Let's remove that sac and let's kind of work our way down through this. All right, so now the sac is gone. Now, on the inside here, you're going to see some fatty deposits. This is visceral fat. Anytime you hear visceral fat, that is fat that is around the organs, not so much that fat that you think about like in the abdomen or, that makes you kind of think of fat that accumulates that you can see. You really can't see visceral fat. Visceral fat is needed. It kind of does protect the heart a little bit, and it does some other things, but too much of it can be a bad thing. When we remove that visceral fat from our look here, we're going to get down to the actual heart muscle itself and a network of arteries and veins. Now, these arteries and veins are the coronary arteries and veins. The job of these arteries and veins is to actually get oxygenated blood to the muscle of the heart. When we talk about these, we're not talking about blood that's being pumped through the chambers of the heart. These coronary arteries are bringing oxygenated blood to the muscle of the heart, whose job it is to pump the blood through the chambers of the heart. Just like all muscle, just like all cells, these cells and these muscles need oxygen just like anything else. And so this is the network that provides that. There are three main ones. You have the right coronary artery, you have the left anterior descending, you have the left circumflex. When these vessels become occluded, that is a heart attack. That's a myocardial infarction, as we're going to call it. And so these are very important. We're going to learn a lot about these when we get to that chapter. The heart muscle itself is very unique. When we talked about in anatomy class all the different types of muscle cells, the heart muscle stands alone. It's a type of smooth muscle, which means that it does kind of do its own thing, but it's a very specific type of smooth muscle. It's the only type of cell in the body that has the ability to create and continue an electrical impulse. And that's very important when we talk about the heart and the heart's ability to keep functioning, even if it potentially loses connection with the brain. The word we're going to use for those cells to be able to do that is called automaticity. Those cells can automatically create an impulse and they can carry an impulse to the next cell. Very important. And when we talk about how the cardiac muscle fires in terms of contraction, it's all done through an electrical stimulus. And we'll get to that here shortly. One of the things I want to bring up too about the cardiac muscle is contraction and contractility. So the more these muscle fibers stretch, the harder that they contract. And so what makes that stretch happen? Well, it's all about the volume of blood that comes into the heart. The more volume of blood that comes into the heart, which if you can remember, we call that preload, the more stretch you'll get with these muscle fibers, the more forceful the contraction will be. And so when we talk about things like losing blood or losing volume or the container getting too big where the pressure drops and we decrease preload, it automatically will take away from the ability of the heart to contract as forcefully as it was able to when it had enough blood in it. That's called Frank Starling's law. Frank Starling's law is that law about the stretch and the contractility. So let's cut away and take a look inside the heart and actually get to the chambers and talk about how blood's going to be moving through this bad boy. Give me a second for this to load. Okay. So what we do have is a cross section of the heart here so that we can see inside of it. Now remember, It's important to think of the heart as actually two different pumps. The reason is because they are pumping to two different places. The right side of the heart's only job is to pump blood to the lungs. Now remember, the blood that comes back into the right side of the heart is coming from the venous side. It's coming from the vena cava. This is deoxygenated blood. This blood is in need of picking up oxygen, and this blood has a lot of carbon dioxide in it that needs to get pushed out. If we take a peek here at an animation, we can see the color blue. Remember, the color blue, we're thinking deoxygenated. And so if we travel with blood through the heart, we're coming into the vena, or from the vena cava into the right atrium here. That right atrium is designed to do one thing. It's designed to take some blood that it gets filled with and push that blood down into the right ventricle. And so if you watch the progression, that blood gets pushed down into the right ventricle. Now, let's back up for a second. How does it not end up accidentally getting pumped back into the right atrium when the ventricle contracts? If you see here, we've got a valve. Valves, for you, those of you that don't really understand what valves are basically kind of a one-way check. This valve opens when the atria contracts and the blood moves through to the ventricles. This valve has three flaps, and it is known as the tricuspid valve. The tricuspid valve is on the right side of the heart. When it opens, the blood moves down into the ventricles. Once the atria stops firing and the blood's down there, that valve closes, the ventricles fire, and all of that blood that's in the ventricles now gets pushed out of the ventricles and on its way to the lungs via the pulmonary arteries. Remember, arteries usually carry oxygenated blood. In this case, though, it is the one time, possibly one other time when you talk about pregnancy, that deoxygenated blood is going to travel through an artery. Arteries, by definition, actually are just labeled that because they are any vessel that goes away from the heart. That's how an artery is actually defined. The reason why we think of arteries as carrying oxygenated blood is because 99.9% of them actually do. But in this case, the pulmonary artery is deoxygenated blood. So it makes its way, all that blood, to the lungs, where it makes its way through the capillary network. It is dropping off carbon dioxide, it is picking up oxygen, and it is making its way then back into the heart to be pumped to the rest of the body. And so if you follow the progression here, we're coming back to the ventricles, back to the left side into the left atrium. Can't really see it very well from the front just because of the anatomy, but this blood comes back to the heart via the pulmonary veins, because veins by definition are vessels that come back to the heart. And in this case, it's the 0.1% that actually carries oxygenated blood through a vein. And it comes back into the right atria. From the right atria, we know that it has to make its way down into the right ventricle, the left ventricle, in order to get pumped to the body. Now, there's another valve on this side that's separating the left atria from the left ventricle. This valve, though, only has two flaps. This valve is known as the bicuspid valve, bicuspid having two. So once that blood is pumped through the bicuspid valve into the ventricles, now these ventricles are ready to fire again, and that blood is pushed out of the left ventricle into the aorta, which is the largest artery in the body, where it is sent out to the rest of the body so that perfusion can take place all over. Now, even though this illustration showed it as one side and then the other. Just be aware that these two things are happening at the same time. The right ventricle and the left ventricle are firing together, pushing blood to the lungs and to the body at the same time. The right atria and the left atria are firing together, pushing blood down to the ventricles at the same time. This illustration only puts it out as being one side, then the other, in order to kind of show you in a slow motion what's happening here. Once that blood makes its way out, it's got a job to do. More blood is coming in. This process goes on non-stop, 24 hours a day, 365 days out of the year for your entire life. There is no stopping this ever. It's kind of amazing if you think about it, that the heart can work that hard and not really get fatigued. We think about other muscles in our body. Just imagine flexing your bicep 60 to 100 times a minute, every single minute of your life. And imagine what your bicep is going to feel like even within the first 5 to 10 minutes. The heart is a miraculous type of a muscle that it can do the things that it does. All right, let's switch gears here, and we'll talk for a second about the actual electric system of the heart, because that is a very important concept too. Give me a second here. So everything we've talked about to this point has been the mechanical aspect of the heart. That mechanical aspect of the heart has to have the electric system of the heart to actually tell it to beat the way that it's supposed to beat. And it has to be very specific. We want the electrical system to fire in a manner where the top of the heart fires first and then the bottom of the heart in sync. And that's why when we listen to the heart, we hear ba-boom, ba-boom. That beating of the atria and then the ventricles is that ba-boom, ba-boom that we get. It has to be that way. You have to move the blood from the atria to the ventricles first. It's the only way this works. So the electrical system is set up that way. When we talk about the heart's own system, it is done through a network of cells that are very specially designed to do this. And these cells are placed in very specific places in the heart in order to make this go this direction that we need. If you look at this through the lens of the electricity, look at it through, in your eyes, almost the wiring of the cells. The wiring of the cells and the wiring of the heart are designed to take electricity from one part of the wiring and move it down to another part of the wiring where it slows down for a second, and then it travels down the rest of the wiring down and then up again to contract. The reason why we have this slowdown is so that the atria and the ventricles don't fire at the same time. This system is led by a node. This is a little packing of cells known as the SA node. The SA node is what we call the pacemaker of the heart. And the SA node generally fires between 60 and 100 times every minute, which, if you put two and two together, is the normal heart rate of an adult. So let's take a look at this system firing. Pause it right there. So the SA node fires, and you see the electrical impulse travel in all these directions, and then pausing a bit as it gets right into here. This is the division between the atria and the ventricles. This is the division between the ventricles. This is called the septum. This slows down to give the atria a chance to actually dump its contents into the ventricles before it continues down and having the ventricles fire. And it does this over and over and over again. If you have a situation where the heart is beating faster, It's because this system gets told to go faster or something goes wrong with it. Same with if you have a heart rate that begins to go too slow. It's either because it's being told to go slower or something is wrong with it. And remember the two systems that are designed to communicate with the electrical system. When you think electricity, think the nervous system. And so think back to the two systems we learned about that are part of the autonomic nervous system that are designed to either increase the speed of the heart rate or decrease the speed of the heart rate. I'll give you a second to think about it. So what did we come up with for the increasing of the heart rate? What part of the autonomic nervous system is designed to increase that heart rate or tell the SA node we need to kick it up a notch? If you said the sympathetic nervous system, you're absolutely right. Remember, anytime we think sympathetic, we think increase, fight or flight. This is also the way the body compensates when something is going wrong with the plumbing, with the fluid, or with the heart itself. Now, what was the opposite part of that system? Let's take a little spin around here so you can see the electrical system through some three-dimensional. Boy, it just looks like a bunch of wiring that's just strewn around in there, but it is placed in a very specific manner. So that part of the nervous system that we know slows down is the parasympathetic nervous system. And the parasympathetic nervous system is that relaxation part of the nervous system that kind of bring you down, that everything is good, feeding, just everything slows down a bit when the parasympathetic takes over from the sympathetic system. Now, just to map out the rest of this, we talked about the SA node. That gap in the middle in terms of speed occurs because of something called the AV node or the atrioventricular node. That is right here in the middle between the atria and between the ventricles right at the top. From there, it travels down the bundle branches. There is a right bundle branch and a left bundle branch. And then it wraps up around into the Purkinje fibers. And there's Purkinje fibers on the left side and Purkinje fibers on the right side. And so you have to also remember that this impulse not only travels down, but also comes back up because your ventricles fire up. They fire up to push the blood out of the heart in that direction. It's hard to see that from the outside, but if you look at it this way, and if we kind of take a peek, let's see if we can put all of it together. There we go. A little bit better in terms of the anatomy. We're going to fire down, up, down, up, down, up, down, up. All right, guys. Well, I think what we're going to do is we're going to call this one at the end of our talk about the heart. And it's about 25 minutes or so into this, and I don't really want to go any further because it'll be a bit of overload. What I'm going to do is I'm going to extend this series out a little bit. Maybe we'll do one extra video on just the blood vessels or the container, and then we'll follow that up maybe with another one on fluid, or maybe we'll combine the container and fluid together. The heart itself, I think, is the most in terms of the information. If you guys have any questions, please don't hesitate. Send a message, reach out to one of us. We're always there for you. Remember, guys, the only way you understand this stuff and the only way you get good at it is to pay attention and learn the details. When you're doing your skills, it comes down to the small details, doing them right. They all add up to success. So keep that in mind, and I'll talk to you guys soon.